Laser hair removal is appropriate for most skin colors and most hair colors. So there are very few patients who don't qualify. Patients who are outliers for laser hair removal would be those who have either very white hair, very light blonde hair, potentially gray hair that is more white. If it's darker gray, they may qualify. Patients who have red hair, especially if it's a very light undertone or has a very light root, those would be outliers. The reason for this is the lasers that we have, they're multiple different wavelengths and they're able to target the melanin or the pigment in the root of the hair. If there is no melanin, aka a hair that is either white or very blonde, laser hair removal is not a one and done. We have no lasers on the market that treat with one session. The average patient will need 6 to 8 treatments for at least 90% hair reduction. But like everything else in life, unfortunately, there still are some outliers. Patients that are the best candidates for laser hair removal are those who have a very light skin type and a very dark, coarse hair. The laser is able to penetrate easily beyond the skin and penetrate deep into the root of the hair. If someone has very fine hair, perhaps, it may be a more difficult target than someone who has very coarse hair. You know, you're concerned that if you have very thick, coarse back hair, that it may be more difficult. It's actually the opposite. You're a much better candidate than someone who has kind of scant, sparse hair or very fine hair. The older lasers that we had up until the past few years, we were able to treat all skin types, but not well. So we were able to treat patients with very light skin, medium colored skin, but our darker skin patients, unfortunately, the wavelengths we were using, it was very difficult to treat the hair and not burn the skin. We now have newer lasers. Here at Plaza Aesthetics and Wellness, we offer the Sciton Bear HR. It has 2 different hand pieces, and on our blend hand piece, it has several different wavelengths. It actually has 3 different wavelengths that are able to appropriately pass that melanin in this patient's skin and focus all the energy on the melanin in the root of the hair. Well, I think the first would be that it may only be one session. Another common misconception is patients think, okay, oh my gosh, it's summer, I need to get laser hair removal. Well, if we're talking 6 to 8 treatments and we're treating patients depending on the area that needs to be treated every 4 to 6 weeks or every 6 to 8 weeks, most commonly every 6 to 8 weeks on the body, this is about a year to a year and a half worth of hair removal. So this will be a full calendar year before you are hair free. This is not something that we can do 1 or 2 sessions and you'll be hair free for summer. Now, there are some patients that occasionally get a very robust treatment and they're able to get a significant hair reduction. That's great if you're one of those outliers, but most patients, it takes several treatments till they're seeing a reduction in the hair growth. Another common misconception is that patients want their laser hair done after they've had a tattoo. If there is ink on the skin, the laser will actually burn the ink and leave a hole in the skin where they had a tattoo. This is also another really good point, that you want to make sure that you receive laser hair removal at a physician-owned and operated medical spa where the staff is all licensed, they're properly trained, they know the appropriate technique to avoid tattoos and risk burning patients over their tattoos or even on other areas of their skin.